Hey, y'all. Welcome to the Brain Dump with Sandy Boone. Just a brief disclaimer about this episode before I get started. This episode is not meant to be medical advice and is not about bypassing safety protocols. It's a nervous system informed conversation about lived experience, trust, and how care is delivered. I'd invite you to bring curiosity, not defensiveness. And at the end of the day, this episode isn't about ADHD meds, it's about who gets believed. So, yesterday I took the last of my Adderall XR, and we know as neurodivergent peeps what that can mean and how much fun that is not when we run out. And I'd like to give you a little backstory here about my ADHD diagnosis. As you know, ADHD is not something that just pops up. It's something that's been there your entire life. And for me, as I worked through my trauma and I got to a space of healing, I realized that not everybody's brain does this. And so I had tried holistic things like improving my gut health. I had tried supplements that were meant to help with ADHD. And in transparency, that's actually why I started doing neurofeedback. And while all of those things were helpful, they did not stop me from being overstimulated. And I've realized over time that a lot of what I thought was anxiety was actually overstimulation from ADHD. So back to the story. Yesterday morning, I took my last Adderall XR. And when I've been working with my provider, we chose Adderall because initially I did not want to take meds every day. And so we started with a short acting Adderall dose, and then we increased that dose to twice a day. And then I really don't like the jolt that I get. Of course, that jolt calms pretty quickly, but we decided to go to a long acting Adderall. And then we realized that I still needed a bit more around 4 o'clock in the afternoon. My current dose is a long acting Adderall in the morning. And then about 2 o'clock in the afternoon, I take a short acting to get me through the rest of the day. And what I've realized about this journey is first, there's this whole process to get diagnosed, right? Because nobody believes that you have ADHD if you're functioning. They don't look at the masking. They don't look about at the amount of effort it takes to maintain all of that. And so for me, it was a shift in hormones and just general mental age, tired of dealing with bullshit stuff that I realized I needed a little support. And again, as I've mentioned before, I'm not anti med, but I want to help you understand how I got to this space. So, yesterday I took my last Adderall. I reached out to my pharmacy to get the refill, and they told me that I needed to follow up with my prescriber. And so, working in the medical field for almost 20 years, I learned that doctors don't really pay attention when pharmacies call to ask for refills, but they do pay attention when the patient calls. So, I went onto my chart, I requested my refills, and I get this message back that says that I cannot have a refill because I have an appointment on Friday. So, it would have been really nice to know that before so that perhaps I could kind of manipulate, like maybe not take it over the weekend so that I would have it this week. But here we are. And it's frustrating, right? Because this isn't really about pills, it's about trust. And I already have to contact the pharmacy every time I need a refill to say, actually, I'm supposed to take two different types of Adderall every day. So there's that barrier. And then there is the fact that after I'd been on it for a while, my provider did a drug test to ensure that I was taking it. And I knew before I went to that appointment that there was very little left in my system. I was fasting because they wanted to check other labs. And so my last dose had been at like 2 o'clock the day before. Well, of course, when the drug test comes back, because I do things to support my liver and my kidneys, I had 0 Adderall in my system. And the response was, well, you're on a low dose, so it is possible that you've cleared it. And so we'll just check it next time. Well, of course, my brain automatically goes to, well, we're going to check on Friday and it's not going to be there again because I've not had it since Monday. So, this surveillance based care activates threat responses, right? Like, am I going to be cut off from this medication? Very much feeling like I have a substance use disorder because I'm panicked about not having it. And, being questioned feels different for late diagnosed ADHD women. First, we had to convince someone that we even had the diagnosis, right? And then we have to convince the world why we're taking medications. And then we have to beg, borrow, and steal to get them. Then we couple this with the fact that competent professionals experience identity threat when they're mistrusted. It's taking away our power of believing ourselves. It's implying that we don't know best. It's implying that we don't know ourselves. This is dancing over a lot of different issues, right? And so, one thing to note here as we look at this from a nervous system lens, ADHD nervous systems already live under chronic self monitoring. We already are realize that we don't get things done or that we take on too much or that there's, the bright, shiny object that we chase after and then we don't finish. Late diagnosis often follows years of masking and compensatory overdrive. And so gatekeeping amplifies the shame, the hypervigilance, the old trauma responses, even when the intentions there are safety. I'm not angry at my provider for safety measures. That's not what this is. I understand that there are people that absolutely take advantage of the system. I understand that Adderall has street value. I get all of that. But also, that's not where we are. That's not who I am. This hits healers harder because they're used to being the trusted ones. We hold the stories that people share with us. This medical mistrust collides with our professional identity. Is this how our clients are feeling? Do they feel like we don't trust them? I know when I see my clients in session for the first time, one of the things I say to them is, I believe that you are the expert of yourself. And I'm often met with this look of shock. And I'm not sure if they don't believe that I really feel that way or if they've never experienced that before. Perhaps I should dive into that a little bit with my clients. But I truly believe that we are the expert of ourselves. Safety does not have to mean suspicion. Accountability does not require humiliation. Care delivered through trust regulates the nervous system more effectively than care delivered through fear. I absolutely plan to have a conversation with my provider on Friday. And I think at the end of the day, this is going to land on trying different types of medications to see what works. And of course, there's stress that goes along with that too. But, as I asked for this prescription yesterday and I requested this refill, I was already in this space of, I have a full day tomorrow. When am I going to be able to pick up this medication? When am I going to have time for that? And so again, that breeds that hypervigilance, that breeds that anxiety, that breeds all the things, right? The things that we're not even naming. And I think about the clients that I've seen that have medical trauma, largely from not being believed. And this is also dancing back on my issue with mold. You know, I went to the doctor. I'd been to the doctor several times over the course of about 6 months when mold toxicity had hit. The first thing that happened is I had this random knee pain. Thankfully, I had a provider that listened. She took it seriously. We did an x-ray. We later did an MRI. There was nothing physically wrong that could be seen on imaging with my knee. Then, several months later, I went to the emergency room during the height of COVID because I was pretty sure that I had a ruptured appendix. And here's where it gets really interesting. My white count was up. I had a fever. I had a rebound response on physical exam. But when they did the CAT scan, my appendix was fine. So I knew with these two incidences that I was about to get a histrionic label. I was about to be told that it was all in my head, but I knew that it wasn't in my head. I knew that there was something going on. So I reached out to a non-traditional practitioner to see what was going on. And when she took my history, she said, I am 98% sure that this is mold toxicity. I just need to get some labs. I could have cried when someone believed what I was saying. I knew how I felt. I knew my body. I knew my nervous system was whack. And so I'd like for you to think about how you felt mistrusted in systems that were meant to help. What does your body do when care feels conditional? And what would it be like for you to name this without self blame? At the end of the day, I'm not angry with my provider. She's just following the rules. The reality is that it doesn't make sense to give me a month's supply of Adderall if we're going to change the prescription. I get that. But also, where was the space for, let me call in 4 to get you through to your appointment on Friday? And then we'll go from there. Maybe that's not their protocol. Maybe that creates a lot of work on their end. Who knows what the reason was? But if I would have had a heads up that this is how it was going to be, I would have made different decisions. And so we're also entering into this space of, I should have made a different decision. I didn't do anything this weekend that required over focus. I'm doing a lot this week that requires focus, and it would just have been nice to have the choice, which goes back to trauma happens the moment we realize we don't have a choice. And I'm not saying that being without Adderall is big T trauma by any stretch, but what I am saying is that it does cause a dysregulated nervous system. So, if you're listening to this and you're thinking, my nervous system never really turns off, that's not a personal failure, it's physiology. And one of the ways I support helpers with high load nervous systems is through neurofeedback, a brain based training that helps the nervous system learn regulation without effort, insight, or willpower. Neurofeedback isn't about changing who you are, it's about giving your brain more flexibility, more capacity, and less time spent in threat. And if you're curious, you can learn more about how I use neurofeedback with clinicians, coaches, and helpers at sandyboone.com. I'd invite you to check it out. Now, I will say, today has not been as bad as I thought it would be. So, yay, neurofeedback is helping. But also, there's a part of me that wonders if I'm still riding on the coattails of yesterday's Adderall dose. And that's very possible. Time will tell. This conversation is about dignity, not defiance. You're not asking for shortcuts, you're asking to be believed. I trust your nervous system, and I hope that you do too. Thanks for listening to The Brain Dump. Take care of you